Hello, everyone that has joined. Thank you for joining. I'm Dr. Singh. I'm the headache fellow at the University of Utah. And today I'll be talking about migraine and sleep. As many of you already know, that this is a phenomenon that is definitely related. And we'll talk a little bit more about what this relationship is. So migraine attacks often follow a circadian a pattern, which means that they follow a day and night cycle. Um, a lot of people will notice that they have headaches in the early hours of the morning, late at night, or even sometimes in the middle of night during the stage of sleep that is involved in dreaming. And Sleep is often a way to reset and relieve a headache, which has been a long known phenomenon. And other studies showed that sleep might be the most protective factor against migraine. So it can reduce migraines in people. There's also this entity called weekend migraine, where people notice that they have more headaches on the weekend after oversleeping, which is a known trigger for migraine. And in migraine, regularity is often the key. So sleeping too little or sleeping too much can be a trigger for a headache. And a recent meta-analysis, which is a type of study that pulls together different studies that have been done and then looks at a combination of those studies, showed that patients with migraine have poor subjective sleep quality. So they did a survey of a bunch of people with migraine and noticed that these people, compared to people without migraine, thought that their sleep was not very good. And this was even worse in people who have chronic migraine. They also noticed that the subjective sleep quality, poor subjective sleep quality, was associated with greater migraine related disability. So these patients were not sleeping well, were also more disabled in their daily life. And the study also found that patients with migraine have abnormal sleep structure with less REM sleep. And that's the stage of sleep that's involved in dreaming, as we also mentioned before. And interestingly, a study showed that cutaneous allodynia, which is the sensation of just touch or something non painful touching you, causes pain. So a lot of people with chronic migraine or even migraine during the headache or even all the time will have more sensitivity on one side of their head or the whole head. And that's what the cutaneous allodynia means. But that can worsen with REM sleep deprivation. So it's just another finding in the research. So there's 4 stages of sleep. There's non-REM stage 1 sleep. So this is the period of sleep where you're just falling asleep. Then there's stage 2 sleep. And this is where your body temperature will drop and your heart rate begins to slow down. There's different on an EEG machine, which are those leads that they can connect to your head. If we look at the brain waves, we notice special things in this stage of sleep, including sleep spindles and K complexes. This part of sleep generally lasts about 20 minutes. And then we have stage 3 sleep, which is the deep sleep, often referred to as restorative sleep. And here the blood pressure and breathing rate drop, muscles will relax, and again, you have the deep sleep occur here. Followed by that is REM sleep. So this is where dreaming occurs, the brain becomes more active, and people are paralyzed during this part of sleep. And dreams will occur here. Your eyes move rapidly. That's why it's called REM. So it's rapid eye movement sleep. So sleep and migraine are really closely related, and this is thought to be through shared nervous system pathways. The deep structures of the brain and the brainstem are involved in both sleep-wake regulation and also in migraine. So that's why we think that both of these things are so closely linked together. These two conditions also share dysfunction of common neuropeptides and neurotransmitters like orexins, melatonin, pituitary adenylate cyclase, activating polypeptides, serotonin, dopamine, adenosine. So there's a lot of overlap in the neurochemicals um, of the brain between these two things. So, we'll talk about different sleep disorders today and how they are related to migraine. So, the first one we're going to talk about is insomnia. We'll talk about obstructive sleep apnea, restless leg syndrome, narcolepsy, and parasomnias. Insomnia is really common. It's present in about 1/3 to 2/3 of the adult population. There seems to be a bi-directional relationship between insomnia and migraine, meaning that people with insomnia have more migraine and people with migraine have more insomnia. And insomnia is associated with increased migraine pain intensity, increased impact of migraine, increased attack frequency, and increased risk of chronification of the migraine. And this association between insomnia and migraine was found to be separate from that of anxiety and depression. So even if someone has anxiety and depression, insomnia is likely to be separate from that problem. Also, cognitive behavioral therapy for insomnia is really effective. This is a type of psychotherapy, and it also is effective in improving migraine attack frequency and pain intensity when it's done for insomnia if the patient also has migraine. So this is kind of a chart explaining that bidirectional relationship between migraine and insomnia. So here, just to reiterate, people with migraine have an increased risk of developing insomnia, and often you can treat the migraine and see if the insomnia will also get better. If someone has insomnia, they have increased risk of developing migraine, having increased migraine frequency, increased pain intensity, and increased migraine impact. And treating the insomnia can also be helpful in treating the headache. And that's kind of what this chart is showing. Sleep hygiene is a really important thing that your doctors will usually talk about in people with migraine. It's a benign intervention. It's not going to cause any harm. An important thing about sleep hygiene is to make sure you use your bedroom as a cue for sleep. So don't do anything else in the bedroom except for sex and sleep. Keep it cool, dark, and quiet. No screens in the bedroom. And if you're unable to fall asleep within 20 to 30 minutes, leave the room so you don't associate the bedroom with anxiety about not being able to fall asleep. Other things you can do for sleep hygiene are go to bed the same time every day, wake up at the same time every day, even on the weekends, avoid large meals before bedtime, avoid caffeine after lunchtime, and avoid alcohol before bedtime as well. And exercise during the day can help with sleep at night, and you should not exercise too close to bedtime, ideally 2 hours before bedtime, because that can stimulate the brain and keep you from sleeping. Another thing that can be helpful for sleep is having a bedtime routine and a wind down routine that kind of helps you, helps your brain to realize that I'm going to go to sleep soon. And here's just a chart with the same things on here. Some people are visual learners, so I thought I would put this in here, but kind of the same things we just talked about in terms of sleep hygiene practices. So the next sleep disorder we're going to talk about is obstructive sleep apnea. So this is a disordered breathing sleep disorder, and it's pretty common. About 20% of the population has some type of disordered breathing during sleep, and sleep apnea is more common in males, 2 to 3.7 times more common. And risk factors for OSA are obesity, specific craniofacial or oral anatomy. So some people just have a way that they were born, and they have big tonsils or a big tongue, something like that, that can cause sleep apnea. People with neuromuscular disorders can also have a higher risk of sleep apnea, and people who use substances have a higher risk of sleep apnea. And what sleep apnea is the person has repeated episodes of decreased airflow, which is then associated with decreased oxygen saturation and disruption of the sleep, caused by obstruction of the upper airways during sleep. And OSA and headache are related. Patients with obstructive sleep apnea tend to have more frequent morning headaches, more frequent tension type headaches. There's kind of a less clear association with migraine, but treating OSA is associated with improvement of number of days of migraine per month, duration of migraine, pain intensity, number of days with inability to work, and decreased acute medication intake. Another study called the CAMEO study, looking at patients with chronic migraine, showed that chronic migraine patients are more frequently diagnosed with sleep apnea, or were more likely to be high risk for sleep apnea compared to episodic migraine patients. And another thing that kind of links obstructive sleep apnea and migraine together is that they both improve with weight loss. Restless leg syndrome is another sleep disorder that's associated with migraine. So restless legs is an urge to move the legs, or an uncomfortable sensation in the legs that usually occurs with rest or an activity, and it's usually improved by moving the legs, and this usually happens in the evening or at night. The estimated prevalence is about 5 to 14% in the general population, so isn't something rare. And the prevalence of restless legs is higher in patients with migraine. And also the prevalence of migraine is higher in patients with restless legs. This relationship seems to be most likely due to a dysfunction in the dopaminergic system, which is a link between these two conditions. So people with restless legs, so the condition restless legs has a significant impact on migraine, and studies have shown that people with migraine who have restless legs have more severe headaches, more sensitivity to lights, noises, more nausea, more dizziness, higher migraine-related disability, and higher scores on anxiety and depression scales as well. Narcolepsy is a pretty rare disease, and it's a sleep disorder which is characterized by overwhelming daytime drowsiness and sudden attacks of sleep. And migraine and narcolepsy are often comorbid, but there's not enough data to say how exactly they're related and what the extent is of this relationship. So there's this neuropeptide called orexin, which is produced in the hypothalamus. It's a deep structure of the brain, and this is thought to be the link between narcolepsy and migraine. Another sleep disorder that occurs in both that occurs in migraine are parasomnias. So these are complex, a sleep disorder with complex movements, perceptions, behaviors, emotions, dreams, and autonomic nervous system activity that can occur during entry into sleep, during sleep, or when you're waking up from sleep, and it can disrupt the quality of sleep. So these are things like nightmares, acting out dreams, sleepwalking, night terrors, things like that, and even grinding teeth at night. So sleepwalking in childhood has been associated with migraine. So this happens most commonly in kids. And there's a lot of evidence that shows that this is more likely to happen in kids with migraine. Nightmares and dream enactment behavior can also be more common in patients with migraine. And bruxism, which is grinding your teeth at night, is also noted to be common in patients with migraine. And grinding your teeth at night can develop TMJ dysfunction, which can also cause headaches on its own. And that's actually all I had for this lecture today. Does anyone have any comments or questions?